Hello, my name is Danielle Adams, and I would like to discuss the topic of watching your blood glucose for signs of diabetes and maintaining the sugar levels within your blood to maintain at a proper level. The reason is because I recently lost my father due to the disease of diabetes in January of this year. And I would hate for you to lose somebody within your family or friends to the disease of diabetes. In America, there are about 25.8 million people with diabetes. The risk factors associated with it, the ones that you can't change, is your family history, if both of your parents have a history of diabetes themselves, your race, your age, and also if during pregnancy you had gestational diabetes. Having diabetes will cause a variety of medical issues, from renal failure, high blood pressure, heart disease, blindness, nerve damage, and even limb amputation or death. There are two types of diabetes. There's diabetes 1, which is typically that you're born with. Your body just cannot maintain the insulin levels that it needs. And type 2 diabetes, which in history is typically developed at the age of 45 or higher. But as of now, a lot of young adults and children have type 2 diabetes. Things that you can change to lower your risk factor is by maintaining a healthy weight, making sure that you have plenty of exercise, not having excessive alcohol or smoking habits. You should always check your glucose levels after each meal and before each meal to get an idea of where you're resting and your after meal blood glucose levels are. If your blood glucose levels are high, you have hyperglycemic. If your blood glucose levels are low, then you have hypoglycemic. Your priority is to maintain a normal range that's neither high nor low, and that way you can usually manage it by the foods that you eat and consistently having small snacks in and out throughout the day, and also ensuring that you get at least 30 minutes of exercise a day. It's really important that you keep a log and record everything so that you have an idea of where you're at and throughout the year and on a day-to-day basis if certain foods affect you, because as you do age, you do have other altercations with foods. For those that do not watch their blood glucose, they typically have high blood pressure, which increases their chances of stroke and heart failure. People with type 1 diabetes have to stay on an insulin regimen. Type 2 diabetes can have medication, but there are other ways in order to wean yourself off of it if you just maintain a regular diet and healthy lifestyle. And for some people, it may be hard, but the end goal is ultimately to live well and live within your time frame. And in order to check your blood glucose level, there are several meters that are electronic that all you do is they have the test strip, and then they have where it will poke your finger and allow a small amount of blood, and you just insert the blood into the meter, and within 5 seconds it will read your glucose. And they make them travel size so that when you travel, it's for easy access. I would encourage everyone to get tested, even if you are or are not diabetic, or even if you have signs. Signs of hyperglycemia is blurred vision, nervousness, you're constantly hungry or thirsty, you have to go to the restroom a lot because of the increase of thirst. For more information, there are several websites, mainly going through American Diabetes Association, which is World Wide Web, stopdiabetes.com, and worldwidewebdiabetes.org. Thank you.